Hello! This week we will tell you more about 4 large groups of diseases that can be caused by unhealthy work conditions. We will teach you about work-related lung diseases, cancer, skin diseases and musculoskeletal diseases.
Workers who are affected by some of these diseases may receive economic compensation. However, the economic side is of less importance here. More importantly, we will tell you how these diseases can be prevented.
We will also tell you a little bit about how a work-related disease can be recognized or diagnosed, and even try to give you some clues on the management of a worker who suffers from them.
Exposure to different kinds of dust, smoke and fumes, both domestic and at the workplace, is the major cause of lung diseases. Lung diseases are the largest group of work-related diseases globally, and more people die due to inhalation of particles at the workplace than due to work-related injuries. This is especially true in developing countries. There are several different work-related lung diseases, but this week we will focus on pneumoconiosis and obstructive lung diseases.
In this case, we see white areas involving both lungs very extensively. This is called silicosis, and this is due to extensive fibrosis due to chronic inhalation of the dust from the mining procedure. For this to take place, the patient usually has to be exposed for 10 years or greater.
Work-related cancer is increasing in numbers. The reason for this is the fact that increasing numbers of industries are using carcinogenic agents in production processes globally. This increase is coupled with a lack of preventive measures in many workplaces. Lack of knowledge about potential hazards associated with the fact that cancer develops slowly over years of exposure has resulted in there being low levels of protection of workers. It is a very serious problem. One example is the carcinogenic substance asbestos that has caused the cancer type mesothelioma in huge numbers of workers. Asbestos is also responsible for several other types of cancer, as well as the progressive lung disease asbestosis. The International Commission on Occupational Health has set a global asbestos ban among its main priorities. Asbestos is an occupational and environmental hazard of catastrophic proportion. Each year, it kills over 107,000 people worldwide and will continue to cause millions more deaths and illnesses. The profound tragedy of the asbestos epidemic is that all the illnesses and deaths related to asbestos are entirely preventable. Safer substitutes for asbestos exist. They have been introduced successfully in many nations. The grave hazards of exposure to asbestos and the availability of safer substitute materials have led a growing number of countries to cease all import and use of asbestos. Despite this, 125 million people still work with asbestos worldwide. Even more concerning is the fact that its use is actually increasing in developing countries. In the session about skin diseases, we will describe different skin disorders associated with work processes, such as, for example, cleaning work. You might think that hand eczema is not a very serious condition, but for a mechanic, for instance, who develops this type of problem, the condition may result in his having to stop his job due to the problems with his hands. This is a huge problem for workers in certain occupations. We will also describe a number of musculoskeletal diseases for you. Low back pain, for instance, develops among a huge number of workers. Sometimes the relationship is clearly related to working conditions. We particularly would like you to be able to learn more about this, as many of these conditions can be prevented by a better organization of work.
This week, we hope you will learn a lot about the different diseases and how they affect the lives of many workers.
We hope you will find it interesting to see these different workplaces and that you will be filled by a wish of improving their work situations, because no one should be harmed at work.